I'm Barbara Hess, Chief Administrative Officer at CEFCU. CEFCU is a not-for-profit financial institution. We are about $4 billion in assets and 50 branches across New York State from Albany to Buffalo. CEFCU has places a real value on employee wellness. In fact, wellness is one of the tenets of our corporate culture, and certainly that commitment has to start at the top. I've always been pretty healthy, do an annual physical every year, and so one of the things that really attracted me to the executive health program at Albany Med was that it was a much more in-depth physical than I've been used to. I'd never had a stress test before I went to the Albany Med executive health program. So I was really impressed with the program. First of all, they're ready for you when you get there. So there is no waiting in a waiting room somewhere for a nurse or a physician to call you. The facilities are very spa-like, so you don't have to worry about white coat's disease because you're relaxed while you're there, and they really make it a point to put you at ease. I found the exam to be extremely thorough, which was great, but then I had a lot of time to spend with Dr. Mitkoff talking about those results. I found that whole experience to just be welcoming and thorough and really respectful and professional. I really enjoyed it. So one of the things that was really fortuitous and really exceeded my expectations was Eileen Corbett, who is the RN and really the concierge for everything that happens in the executive health program, told me if I needed a concierge for any other medical services to give her a call. So I had an interesting experience. I was out west skiing on vacation a month or so later, and I took a bad fall and broke my shoulder in 3 places. And after it had been x-rayed and they were telling me out in California I needed to get back to New York, to Albany, and see an orthopedic here, I thought to myself, well, I don't know any orthopedics, what am I going to do? And of course, I recalled Eileen's conversation with me, and she was the first person I called. And she said, I feel terrible that this happened to you. Give me a minute, I'll call you right back. So within 15 minutes, Eileen was back on the phone with me. She had scheduled a Saturday morning appointment with the Bone and Joint Center, and they were waiting for me when I got there, and it was just a really nice additional benefit of that program that I hadn't foreseen really needing to use, and it was great that it was there for me. I knew I had experts I could go to who would direct me in the right way. And so as you're trying to fit a physical exam and medical services into a busy schedule, this is by far the best way to do it.